Blood pressure assessment. Blood pressure, the measurement of the force of blood against artery walls. Force comes from the pumping of the heart. If arteries are hardened or narrowed, this force might be increased to pump the blood throughout the body. Measurement. Measurement is done by listening for two sounds with a stethoscope. The first sound and the change in sound, or in some instance the last sounds. The first sound is called the systolic blood pressure. It means it measures the pressure in an artery when the heart is contracting. The change in sound or lost sound heard is the diastolic blood pressure. It means it measures the pressure in an artery when the heart relaxes between the contraction. Measurement. The unit of millimeter of mercury. The top number systolic is charted best. Then the diastolic, as in a systolic. 120/80 is an example of a blood pressure, and this could be in millimeters of mercury or mmHg. Blood pressure values. Normal range of blood pressure is equal to 90 to 100 by 60 to 140. Someone whose blood pressure is less than 90 to 100 by 60 is said to be hypotensive. Someone with a blood pressure greater than 140 by 90 is said to be hypertensive. Normal blood pressure value. Systolic top number less than 120, diastolic bottom number less than 80. High blood pressure directly increases the risk of coronary heart disease, which leads to heart attack and stroke, especially along with other risk factors. High blood pressure can occur in children or adults. It's particularly prevalent in African American, middle-aged and elderly people, obese people and heavy drinkers. People with diabetes mellitus, gout or kidney disease have hypertension more than instruments necessary to complete the procedure. Blood pressure cuff sphygmomanometer. This must fit the arm properly. The width of the cuff should approximately equal the width of the upper arm. Stethoscope. Procedure. Person should be comfortably seated or lying down. Should have rested for 15 to 20 minutes prior to the reading. Arms that are paralyzed, injured, have an IV or shunt should not be used. Infant blood pressure can be taken on the leg, but adults must use the arm. Electronic blood pressure equipment can be used. The type used most often in the hospital setting is the Dynamap. Excess air should be squeezed out of the cuff. Cuff should be placed snugly on upper arm. Gauge should be easily visualized. Valve should be closed but easily able to be opened. Two techniques for obtaining the pressure. Find radial pulse. Pump cuff till pulse no longer palpated. Then pump another 30 mmHg higher. Place diaphragm of stethoscope on brachial artery about half to 1 inch above the elbow. Release the valve and listen for the two measurements, slowly deflating the cuff. Find brachial artery and put diaphragm over the side. Pump cuff to 120 mmHg and listen for the heartbeat. If it is hot, pump another 30 mmHg and listen again. When the pulse is no longer hot, then pump another 30 mmHg and slowly deflate, listening for the two measurement. If reading is certain, wait 30 seconds to 1 minute for remeasuring. Record the reading and report any abnormalities. If the blood pressure reading is outside of the normal limits, retake it before reporting the value to a supervisor to be certain of accuracy.